What if the future of medicine wasn't just about new drugs or procedures, but about helping the body repair itself at the cellular level? Stem cells are often called the building blocks of regeneration, but they are also surrounded by hype, confusion, and misinformation. And later in this conversation, Dr. Newman will share one surprising truth about stem cells that most people, even doctors, misunderstand. Hello, everyone. I'm Dr. Priyanka Mathur, an international physician with experience working across healthcare systems in multiple regions around the world and the founder of MediPocket Global Medical Concierge. At MediPocket, we help patients connect with world-class specialists and access advanced treatments, wellness programs, and fertility care across borders, guiding them through complex healthcare journeys with personalized support. Through conversations like this, our mission is to bring clarity to some of the most complex and rapidly evolving areas of medicine and longevity, from precision health and regenerative therapies to innovations shaping the future of healthcare. And today, I'm delighted to welcome someone who has been working in regenerative medicine long before it became part of the mainstream conversation. Joining us today is Dr. Nathan Newman, a renowned Beverly Hills dermatologist and pioneer in regenerative medicine. Dr. Newman has spent decades researching and applying stem cell therapies and regenerative techniques, helping patients restore tissues, repair damage, and approach aging through cellular science. Dr. Newman, welcome. It's truly a pleasure to have you with us today.
Thank you very much for having me. It's my honor.
So let's jump into the origin story. You have been working in regenerative medicine long before it became a mainstream conversation. So, what first sparked your interest in stem cells and regenerative medicine?
Regenerative medicine actually found me. I was doing a fellowship in cosmetic surgery. We were doing a lot of fat grafting, and at that time, the techniques that were used were not very good techniques. There was a lot of complications. The results were not very good, and we were constantly trying to improve the technique. And we went from what we call an open system, where we took the fat out and dumped it into a sieve and just scooped it up with a spoon into a syringe and injected it back, to actually leaving it in the syringe that was taken out, keeping it closed, keeping all the cells together. And we noted that the cells in the syringe level out in different layers. The bottom layer was sort of the water and the blood. There was a little hazy layer in between. Then there was a little bit more of a dense layer, and on top it was like an oil layer. And a paper came out describing that these layers are different in that hazy layer is where a lot of stem cells are found. And that really changed everything about how I looked at what we were doing, because I quickly realized that in the open system, we were throwing away those cells because they were so tiny, it would just be washed away in the open system. But in the syringes, we were keeping them and we were getting better results. So I said to myself, what happens if we were to concentrate and increase the ratio of those cells to the fat? Will we get better results? And lo and behold, we got much better results. And I started using it for post-cancer reconstruction. I used it for cosmetic surgery, doing stem cell facelifts, and I kept seeing over and over again how the concentrated stem cells were allowing the skin and the tissues to heal a lot faster, to become a lot more youthful. All the wrinkles got better. All the damaged tissues got healed. And it was one patient in particular that I treated who had a really hard scarred tissue that was from a cancer that was removed. They did radiation on his face, left a big hole in his face that could not be repaired using traditional techniques, because anytime they would inject or they would cut to fix the hole, the skin would start to die because there was no blood flow into that area. And when he came to me, he heard I was doing stem cells. I didn't think I was going to be able to fix it so much. I thought I was going to improve it a little bit. But as I started to inject him, his bone came back on his jawline. The pain went away from his nerve endings. The tissue that was burnt sort of healed. The hole was gone, and the feel of the tissue became normal again. And that really made me a believer in stem cells and made me really delve into it and become the mainstay of my practice.
Wow, a beautiful journey. And I think the healing for the patients, not only just the look wise, and you mentioned like this cancer survivor, the pain part. Um, so when you began exploring these therapies years ago, what were some of the early challenges or skepticism you encountered?
From the doctors, they really want to see scientific evidence, they want to see published papers, and there is nothing at the time that was published. This is all new. So most doctors didn't understand stem cells, just like the lay people didn't understand it. What was prevalent at the time was embryonic stem cells. This is about 26, 27 years ago now. And embryonic stem cells has a lot of problems with it medically, but ethically, it also has problems because it has a potential for life, and we're taking from another person and we're putting in, and we weren't getting very good results with it anyway. So we were not using embryonic stem cells. We were using adult tissue stem cells, which are already sort of becoming part of the human being that has developed, and the job is to repair, regenerate, and renew the tissues that are breaking down. So the hair that's growing, the skin that's renewing, every part of you that's renewing um, is from stem cells. They're the ones who renew and replace all the older cells. In fact, we used to think you're born with a certain amount of brain cells, where you're born with a certain amount of fat cells. We know that's no longer true. All these cells are being replaced. So everything that we were taught or we thought was true is, has changed because of regenerative medicine and the knowledge we've gained from it. So we had to explain to people, this is not something that can become a human. This is cells that are already part of the tissue, and they know their job is to repair and regenerate tissues in a very holistic manner, in a very good way that the body understands. And that was the biggest challenge, to convey that to the public and to the doctors. Thank God things have changed a lot since then. Most people are talking about what kind of stem cells and what we're doing when we go to the conferences, but that was the biggest challenge to begin with.
So let's understand stem cells for listeners who may be new to this field. And again, there's a lot of information, and I say sometimes there are a lot of noises on when you are not specialized. So, how would you explain what stem cells are and how they contribute to regeneration in the body?
Stem cells are genetically programmed cells. They are there from birth, as as when you're a baby and you're developing in the womb. The embryonic stem cell differentiates to all the different parts of our body, and as those parts develop, the the body needs a way to be able to renew itself, to grow, to regenerate, to heal. And the job of those stem cells is to do that. So every part of your body has stem cells in it. In Spanish, they call it mother cells. In stem comes from the fact that everything comes out of that. So other cells are coming from the stem of these cells. So they have the ability to divide into other types of cells, but they also have the ability to maintain their uh, their stemness, their ability to continue to maintain this sort of pocket of cells that are there to keep you alive, healthy, and vibrant. The most amount of stem cells are found actually in the fat, and the fat contains about 500 times more stem cells than the bone marrow, and the bone marrow is what's usually known for the stem cells. So we know bone marrow transplantation. People used it for many, many years before we started using the fat stem cells for our purposes. They were using it to do cancer treatments and to save people's lives. But the amount of cells in the bone marrow were dramatically reduced after you stopped the growth phase. So you were great for like the first 20 years of your life. You have great bone marrow stem cells because you're growing and your body needs it. But once you stop growing, you don't need those stem cells. So the number of the cells in the marrow and in the circulating blood goes down a lot. So we used to think that you need to have these young cells to do everything. But we know that that's not true because we've tested cells from the fat at young ages to middle ages to even 80s. And the cell population actually is maintained in the fat. It doesn't drop like it does in the bone marrow or in the blood. So some people say, "Oh, I'm too old for my body. The stem cells don't work." Well, if your stem cells are not working, you're not alive because you can't repair and rejuvenate yourself. Your hair won't grow. Your skin won't renew. Your nails won't grow. So all the parts of you that is healthy and functioning is because you have good stem cells, and and that's a very, very big part of understanding why we're able to use this technology for the benefit of our health today.